relationships with colleagues has certainly changed during the pandemic. It could be as simple as, mask wearing kind of takes away that personal experience and that friendly experience that you have with coworkers. And it's a constant reminder of, having to social distance and, not having that same interactive type of relationship. And then from, a very evident and very concrete change as a screener, having, being separated from your colleagues in these glass cubicles, again, having to socially distance away from them really takes away, from the interactive and, relationship side of being at work. So being isolated, in a cubicle is, very isolating in your experience and just kind of makes work feel more lonely in a sense. I think the most difficult part of being a healthcare worker during the pandemic, in particular in my case, I work in long-term care, and so it's been really hard seeing predominantly how the residents are struggling. Up until recently, their movement has been very limited, so for a really long time they were isolated to their floors, especially if there were outbreaks, of course, for a reason. And a lot of them were not able to go outside of the premises unless they were going for like an essential appointment. And so I think the mental health aspect for the residents, even though there's, some sort of activities, that they can do, they're still allowed visits. A lot has changed. A lot has changed for them, and that's the hardest part, is seeing like a vulnerable population, such as seniors. It's really hard to sort of see that, because there's nothing you can really do to make it better for them other than treating them nicely every single time you see them in your limited interactions, and saying hello and reminding them that you care. Being a healthcare worker during the pandemic has certainly impacted me emotionally, especially in regards to working in a long-term care home and having to deal with enforcing standards for essential caregivers. It's been emotionally very challenging for them in adapting to these new rules, because they want to see their family members, and at times it's a bit harder when they have to get tested and they don't meet certain criteria, etc. It's really challenging, especially it was more so at the beginning. People are starting to adapt more, but then of course you have a few individuals who consistently want to fight you on rules as simple as mask wearing. And so when they defy you and they continuously, try to make it a lot harder for you to enforce these rules, I'm just trying to do my job. And it just takes an emotional toll on me in the aspect where, firstly, why is this person fighting with me? And second of all, it just makes me upset because I feel like I'm not doing my job properly. So the enforcement of a lot more rules has definitely taken more of a negative emotional toll on me. But when people are in fact abiding by the rules and being sympathetic, I think it has more of a positive impact, because people understand that I'm just trying to do my job, and it just makes my day easier. During my time off work, I just like to do things that I normally do, just to kind of have a sense of normalcy even during the pandemic. So leaving that behind, that stress of work, and just doing things that are regular in my routine. For example, I really love cooking, so I always make time for cooking. And then in terms of hobbies, I really love to play video games with my boyfriend, so that's really fun. We love to watch TV and new Netflix shows. I also love to watch scary movies. So just doing sort of like normal routine things during my time off is super important, just because it brings the sense of comfort and normalcy, and it kind of takes away the stressors of being at work. There's definitely a lot that I've learned during this pandemic. It could be as simple as not taking for granted something as simple as your work environment. I mean, the public health sector and public health institutions have really taken a hit in terms of how the daily environment has changed. So it could be something as simple as, not wearing your mask. Something we've taken advantage of definitely is really being able to walk wherever we want without being screened, and also having more interactions with residents is very, very important. So those little things that we never thought could be jeopardized, and going forward, social interaction I think is going to be something that's even more held close to us, because it's something that to a certain degree has been taken away from us. And so for future healthcare workers, I'd certainly give advice to them about how treating people every single day with the utmost respect, whether you're working with residents or whether you're working with patients, really being sympathetic in what they're going through in their daily life and taking the time to ask them, how's your day going? Or what are you up to today? Just letting people know that you care about them a lot more, and really appreciating that social interaction aspect is going to be very important. I would definitely give that advice to any healthcare worker.